like that. Hi, everyone. Happy Tuesday. Yay, Tuesday. How's it going for everybody, right? Looks like it might storm outside again. Yeah, I know. Yeah, I hit it yesterday, big old hailstorm. I was like, thank God they're not big enough to damage my car. Yeah, but what do you do, right?
Welcome to Colorado.
Yeah, exactly. I know, you never know when. How are you guys? Dr. Ashley DeBoer.
And Dr. Christina Holland from Inclusive Care.
And Rise Chiropractic. So we thought, Dr. Christina thought it would be a great idea. I thought so too when she told me about it, right? To talk about maybe our top 10. These are our top 10 things to do during pregnancy, for delivery, and to prepare for birth and delivery and everything like that. So we came up with our favorite, just about 10 things, maybe a few added in there, right? But 10 things that we think that you should definitely do to prep for birth. Yeah. Right? Yeah. So our list is not in any specific order. No. It's not like do this, it's number 1, number 2, right? No. So what do you want to talk about first?
Perineal massage is the first thing that always comes to my mind.
Yeah, she loves herself some perineal massage.
I realized after I said that, I get phrasing. I don't know. Maybe that's accurate.
Right.
I guess no one's probably surprised at this point.
Yeah, exactly. No, it is a very, very important thing to do. And I think, I don't know, I'm going to guess maybe 15% of moms are actually told to do it.
Yeah.
You want to talk about a little bit what it is?
Yeah. So the perineum is kind of the space between your vaginal opening and your rectum. And that's a space that has to expand to be pretty wide and stretchy to let the baby's head come out.
Have you seen the thing floating around of like how big 10 centimeters actually is? Like a paper plate.
Oh.
Yeah. And you're like,
yeah.
Wow. Okay. Our bodies are amazing.
They are.
So it's got to stretch for sure.
It definitely has to stretch. And it can be super helpful. There's actually research on perineal massage, which I think is really cool, especially in first-time moms. And it's shown to reduce the likelihood of a tear. So that's great. We love that.
Yes.
So the way that you would do it would be to if this is the vaginal opening, you would want to, if you're doing it on yourself, you'd want to use your thumb because leverage can be challenging. We have a message, perineal massage rocks. It does. It really does. So here's your vaginal opening.
Is that another body worker of some sort or PT or something?
Yes.
Okay, I was going to say,
yeah,
we love our perineal massage. Hey, what do you say?
So you would push down kind of on the very bottom of the perineum and apply some pressure, and then you can sweep out to the side. So you can do that yourself with your thumb, so it would kind of look like this, one at a time. Mom. So either way. Yeah. And then if you can also have your partner do it where they can put their fingers this way and push down and out, or you can see a pelvic floor physical therapist. If you have a midwife, they will likely do it. So there are definitely options, and that should start at 34 weeks, I believe.
And using some sort of oil, dry?
Not dry. Nothing near your vagina should ever be dry.
Just making sure.
A lubricant. I would probably use lubricant.
Yeah.
You can also use like a little bit of coconut oil.
Yeah. Because we all have coconut oil, like in massive bottles all over the house.
You should have a different, about coconut oil, you should have a kitchen coconut oil and a bedroom coconut oil. That's what you're going to use.
Yeah. That would
Don't do a scoop thing and share that. No double dipping.
Okay.
Happy Tuesday.
We went there.
Happy Tuesday.
Right there, yeah. It doesn't mean you can't still have a big jar. Just take some out and put it in another jar. Yeah, so I totally agree with Dr. Christina in that perineal massage is super important. The more you can get in there and work it out yourself or with a partner, whatever you're comfortable with, like she said, it's definitely can help from tearing. And even, I don't know if it's in the research. I'm just going to go with that because I talked to a lot of moms, even if they had been doing that and they tear, it just seems to be less significant, and stuff like that. So that is definitely very important. Yeah, for sure. What do you think the next thing should be? I have our little list here. I have written down breath work. Okay. Yeah. So I'll talk about breath work in just a sense of stabilizing core and helping you to be more strong in your core during pregnancy and also help with pain. So, well, we talk a lot in the postpartum period about diaphragmatic breath and stuff like that. It is very important to do while pregnant. It is a little bit harder because it just feels funkier, especially if it's brand new kind of breathing to you in general. It'll feel different, but it's the exact same concept. Filling the cavity with pressure, essentially, right? Because our breath doesn't leave our lungs, but same thing. So filling that cavity with pressure and being able to hold that pressure with breath is very advanced, or just with breathing in and out. So I practice that a lot with my prenatal mommies, just so that they can lift properly and stuff like that, which we're going to talk about a little bit more. But I know, Dr. Christina, you talk a lot with your patients as far as breathing and pushing, right?
During delivery, right? So if you think about, we've talked a lot about how you don't want to poop. You don't want to push when you poop, right? You want to try and let everything relax and let things exit your body with that relaxation, with using that pressure system to kind of increase pressure downward.
Yeah.
Basically having a baby is like that.
Right.
It's not always possible. And the reason that it's not always possible is if people are having epidurals, that can make it more challenging, because it just depends on how much feeling you have. Some people who have an epidural probably can do it, and some people who have an epidural may not be able to feel kind of the timing of the contraction and then timing their breathing with it. But basically what you want to do, instead of what they show in the movies, which is squeezing your eyes in every orifice and just pushing as hard as you can and not being able to breathe.
Yeah.
Which can cause people to do things like pass out, for example.
Yes.
Get extremely lightheaded.
Yeah.
Is also what's going to create a ton of pressure down on your pelvic floor. So we worry about things like vertical prolapse with that. What I like to do instead, kind of teach people to do, and sometimes people will come see me before they go into delivery because they just want to, one, go through all their options, two, get their pelvic floor checked out, see what their kind of baseline before delivery is, and get all of the tips and tricks, kind of a lot of the stuff that we're going over now, which is pretty cool.
Yeah.
And I can teach people how to do this, but
we don't have that specifically listed on here, but one of the top 10 things you should do to prep is go see a pelvic floor PT. It's not specifically listed. We kind of glossed over that.
Yeah.
I just realized that. But yeah, even if it's not your first birth, right?
Yeah.
Like you've went through it before and stuff like that. I think it's super important. But sorry, I didn't mean to cut you off in what you were saying.
That's okay. But basically the idea is that you want to take a big deep breath in, feel like you're trying to push the air down into your pelvis and try and expand your pelvic floor at the same time. So almost like you're trying to feel like your two sit bones are moving slightly away from each other. And that, or if there were a flower at your vaginal opening, that the flower is opening as you inhale. And then when you go to exhale, because what you're trying to avoid is basically the baby's coming out, right? You don't want to suck the baby back in.
No.
Which can happen.
Oh, it can totally happen. Yeah.
So you want to
so many times you're like, there's the head, there's not the head.
Yeah, you want to make it as efficient as possible, and the way you can do that is by trying to keep, one, pressure down in your abdomen and pelvis, and two, keeping those muscles relaxed and not tightening them. So if you take the deep breath, try and let your muscles expand, and then as you exhale, trying to do an open mouth exhale, or like growling, or like a huffing, or
it's a very very primal sound, right? Because was it you that was talking about relaxed chin, relaxed pelvic floor? Okay, or mouth, or whatever you want to say.
Exactly.
So the connection or whatnot there. So if obviously this is something you can practice while being pregnant, but if I know that's just kind of a brief explanation or whatnot.
Honestly, the best time to practice is when you're pooping.
Okay, there you go.
Yeah. So then you just know you're not holding your breath. You're able to keep everything relaxed the whole time. It can be a good practice.
Yeah. So if you're not sure if you're doing it correctly, right? That'd be a great time to reach out to a pelvic floor PT or Dr. Christina herself, and she can guide you through. They'll say, you are doing it correctly. So many times I have moms like, I'm not doing it right. You're like, you totally are doing it right. You just don't think you are. You just need that
second set of eyes.
For sure. Yeah. So I think that is great. But and if you poop in pregnancy, everybody poops, okay? If you didn't poop in pregnancy, somebody didn't tell you that you pooped in delivery, I should say, not in pregnancy, right? Yeah, just saying.
Just part of it.
Yeah, it is just part of it. I'm like, you're so out of it. What do you care? Something else for somebody else to clean up, right? Yes. So the next thing, so we'll say the breath work we'll go with that and see your pelvic floor PT, because we didn't make that like 100% a number 2, but we'll make that number 2. Number 3 is kind of my specialty, chiropractic. I highly, highly, highly recommend, not just because I am a prenatal chiropractor, but even if I wasn't, I would probably still highly recommend, I hope, right, to get adjusted throughout pregnancy. I adjust till you deliver. So I have mommies that start super early on, and we're going to 39, 40, 42 weeks, however it is until you deliver. But
42 weeks.
Yeah, yep. 41 weeks and 2 days, I think, is average, I think was the last study or whatnot. So yeah, but just keeping your pelvis in alignment will greatly help with pains of pregnancy. I know so many mommies are told like they have low back pain, or they have sciatica or rib pain, that is normal, that pain won't go away until you deliver, which in my office is almost absolutely untrue. I have some mommies that struggle with stuff, but we definitely, just by getting adjusted, make them feel a lot more comfortable. But almost all of them, if they are coming in complaining of something, we resolve it while they're still pregnant. You don't have to deliver the child. But so it's really good for aches and pains. So I always say any ache and pain in pregnancy is not normal. So definitely visit a chiropractor who loves pregnant mommies. A good way to tell somebody that really loves pregnant mommies is just on their setup. So do they have some sort of pillows for you to lay in if you're going to lay face down? Do they have a table that the belly part swings away if you're going to get adjusted that way? You know, that's really good indicators of a good prenatal chiropractor. I myself never side posture, lay you on your side to adjust in pregnancy. That is a personal preference. There are some chiropractors that say it's totally okay early pregnancy and not so much in late stage. I just believe unless they're giving a very specific side posture adjustment, you're putting unneeded torsion into the uterus, which is not what we want. So getting adjusted definitely keeps the pelvis in alignment, the ligaments that support the uterus in proper tension, and I guess we'll say alignment too, so that the uterus is in a nice open position, so baby can get in that optimal head down position facing your tailbone, so that you'll have an easier birth. You also want a nice tucked neck, so it can help get in that position too. The biggest part of the head is what is pushing to help with dilation. So if baby is looking up or side, it's just harder to dilate.
When should people start worrying about that?
Positioning?
Yeah.
I say I love to see mommies around 32, 33 weeks if their baby is not positioned. That is usually when, like, especially a home birth midwife will start to kind of get on it. Your OB a lot of times will not talk about positioning until 34 to 36 weeks, which if you have a transverse, a breech baby, or a baby that's OP, or a baby that's sitting up on your pubic bone, that's kind of the terms they like to say, sunny side up, so facing out. After 36 weeks, they can get into proper positioning still, just with getting adjusted, but it just makes it a lot harder. So the earlier the better. You're not crazy for asking 32, 33 weeks. You have an idea of where baby's located. Depending on your practitioner and how good they are at mapping baby and feeling baby, they may or may not be able to tell.
Okay.
But yeah, so definitely 34, 35, 36 weeks is really pushing it, but still have had a tremendously high success rate with just adjusting and getting baby into proper positioning, even 37, 38 weeks. I had one mommy that baby was just stubborn, and literally not until like 2 days before she went in to deliver at 41 weeks did baby get in optimal position. Yeah. So it can take some time and nerve wracking for mommy, because unfortunately, especially breech babies, there's just not many practitioners that allow a breech vaginal birth. So it's like C-section, you know, so that's a whole nother discussion about how your mental state can keep baby in the improper position too, right? Because of a stress adjusted by somebody who loves prenatal mommies is a really great idea to prep for pregnancy, to help with aches and pains and get that baby into proper alignment too, and to also help with the postpartum recovery and just getting everything to go back to where it's supposed to be. Right? We hope at least.
What you were saying reminded me too that we talked something else on our list was talking about handling aches and pains during pregnancy. And so we talk a lot, right, about back pain. I think you and I both talk about it, some pubic symphysis pain in the front. But even like wrist pain or upper back pain, if you're having pain during pregnancy, you can't really count on it necessarily immediately resolving postpartum.
No.
And now you're also caring for a baby and carrying around the carriers. This is going to be the hill I die on, is those stupid baby carriers that are just like really not ergonomic, and they're really heavy.
Them big car seats. Yeah. She's talking about the car seats. Yes. Well, because it's like, and then the car seat itself is anywhere from, like, on the lightest I've ever seen is 8 pounds on up, and then babies at least, come on, like
probably like
8, 9, 10 pounds. I mean, they just grow, right? So yeah, they are not great. But yeah, that's a great point. You know, the reason we talk so much about lower half pain is because that's really primary complaints. But I'm sure you see too. I have a lot of mommies come in that, yes, they write down on their intake paperwork, low back, sciatica, baby positioning. But when I'm like, how's your middle back? How's your neck? Are you having headaches? Are you having wrist pain? Are you having your ankle pain? You know, that's a secondary thing, because they have
like, oh yeah, I had that before,
induced,
or even like, oh, I've had that forever during pregnancy, but now it's really been flared up. I think once I'm no longer pregnant, and it might, but I think it's a risk. I just would handle it ahead of time and have a time, especially before first baby. We have to go to appointments and So
still seeking out therapy or chiropractic or some sort of body work or acupuncture or whatever is very, very idea while you're pregnant for any kind of aches, pains you're having not related to pregnancy. Right. Postpartum bodies are a weird thing. So yes, it may resolve, more than likely no, and it will get worse. You know, and it's just like you said, and then it's it's just natural for us mommies to put ourselves on the back burner for years, you know, and then you're like 6 years postpartum and you're like, yeah, maybe now. And you've been suffering all that time. That's no fun. Another thing was that we definitely want to talk about is, I said mindful strength building or lifting, and then also lifting mechanics. So it's a good thing. Obviously, I preach so much about that delivery is really the most athletic event you'll ever go through. It's a marathon times 5 million. Just saying, you know, so to train not only for birth, so making sure that, you know, you're still doing movement, whatever you like to do, and some strength training is very good to be strong during that time, and some endurance a little bit too. But I know you were kind of talking more about like just, you know, lifting for proper mechanics when you're carrying the carrier or when stuff like that.
Right. I think we've talked about before that people are, so I think there's been this myth, right, that if you didn't exercise before pregnancy, you can't exercise during pregnancy.
Yeah, you're just supposed to like chill.
Just hang out. That is a myth. So it is safe. You want to make sure that you're going to see a provider and you're working with someone who can help create a safe exercise program for you during your pregnancy period. But then we think that even if you're not going to exercise during pregnancy, or if you're being encouraged not to for any number of reasons, maybe because your back hurts, or anything else, then postpartum, you don't have options. You have to take these stairs carrying, again, that 10-pound baby, and you have to take the stairs carrying the car seat carrier, and even just getting the car seat carrier in and out of the car.
But getting baby in and out of wherever they're sleeping.
The bassinet. So just keeping those things in mind. And I think they're just, in general, there's this trend on like crazy exercises on Instagram that people want to do. And I just always recommend people go back to the basics, especially during pregnancy, about things that are going to be functional and important for you to be able to do with baby during that new postpartum period.
I think maybe we'll revisit that again on a video too. Have we done that? No. Okay, so that'll be a great topic. Write it down so we don't forget. But just talking about what would the basics look like, right? And what I don't want to say necessarily is safe, because it's very highly dependent on what you were doing before too. But some stuff to maybe avoid and stuff too. So we'll do another video on that maybe in a couple of weeks about what that looks like and stuff like that. But it is very important to say, I mean, even if you're getting towards late stage pregnancy and all you can do is walk, or all you can do is very gentle prenatal yoga, awesome. Breath is always great too. The connection, and just whenever you're breathing properly, you're heightening your parasympathetic nervous system, which is your rest and digest part. So we really need that. In as much as we need sympathetic, get that baby out, we need the parasympathetics to be kicked on too, so you can dilate. And
I'm really glad you spread your legs to really demonstrate what was happening.
I mean, this one you can't maybe. Sorry for. I don't know
if you can see it, but I can see it, so it was great.
You talk with your hands, I talk with my legs. What do I say? I talk with my hands too, right? Also, with that being said, right? We have talked about Kegels so much, right? So as much as we want to be able to relax, which a lot of breath work will contract and relax too, but maybe talk a little bit about Kegels in pregnancy.
Yeah, so Kegels are really important to start doing. It's pretty much, I mean, everyone should do Kegels all the time. I recognize that not everyone is doing Kegels all the time. I know Ashley's doing them right now as we talk about it, but that's probably the only time she does it once a week. Is when
you can tell when my first. No, not right now.
So
proper Kegels, right? That's the other thing too, and
train them fast and slow. So for long holds and also for quick flicks, which we will talk about. I'm sure we've talked before, and we will talk again, I'm sure. Yeah. But at some point, we'll
talk about them over and over and over again, because they're the only things that you see being recommended really with any kind of pelvic floor issue, which we've said 1,000 times. That may not be the only thing. It might be a part, or it may not be a part right at the beginning, but needs to be into a part, right? Or become a part of it later on or whatnot. But sorry.
But basically about the time that you start doing that perineal massage, you want to probably stop doing Kegels for the most part. Of course, that is like a very broad generalization. There are absolutely people for whom I've seen them and recommend that they keep doing their Kegels during pregnancy, but they're usually bringing other things into it. First-time moms who don't have any history of like issues, pelvic floor issues known, or especially if you know that your pelvic floor runs really tight, I would definitely stop doing Kegels around 34 to 36 weeks.
Yeah.
And really focusing more on that like deep breathing, letting your pelvic floor relax, as opposed to contracting and trying to get it tight.
Yeah. So again, why it's very important to see a pelvic floor PT prenatally, okay? Because they can just assess that for you, you know, because with anything, Google. Googling, how do I tell if my pelvic floor is tight? You may get some great ideas and you may not. So you just don't want to be training it improperly, right? Overly tight pelvic floor is not good for delivery, and super lax is not good for delivery. So you really want that optimal tension of the pelvic floor, whatever that looks like in your body. Yeah. Yes. And so the next thing.
Sorry, one more thing about that.
She loves Kegels, right?
I do have people who come in and they're like, well, my pelvic floor's always been really tight. I know this about myself. And they're like, do you think it's the reason that I didn't dilate properly and I had to get a C-section? So I normally see that, after delivery. And the answer is we don't know, right? There's no research on that. It's really hard to say. I think it could play a role. I could kind of argue either way for it, honestly. But at the end of the day, if that does happen, you can't. I put in the title of this video, like, these are the things you can control. If for whatever reason you were hoping for a vaginal birth but ended up needing a C-section, that's totally fine. You're just not going to, there are things you're not going to be able to control, but that's why we're trying to give you the things that you really can, and so that we can all control the things you can and then hope for the best for the rest of it.
Yeah. And that kind of comes with, we definitely have down the line of creating birth wishes, which I like to try and talk about and stuff like that, more so than a birth plan. But before we get to that, I wanted to talk a little bit, sorry, my son is throwing dinosaurs. Talk a little bit about, I have a lot of mommies ask about spinning babies. I've taken their practitioner course, which is a great course. If you're a practitioner and you work with pregnant mommies, it is a really great course. You really go over their main 3 exercises, which are called the 3 sisters, but they are great exercises to really be doing anytime in pregnancy. It's basically inversion. There's some supported belly, I guess we'll call it massage. It's kind of rocking the hips and stuff, but you put a rebozo or a scarf around the belly and shake it thinly. Please stop. Multitask, right? And then the last one is a sideline release. So it's like a sacrum ligament release. So those are really great to do. You can look them up on their website and you can really start them at any time. Just kind of helps to another resource at home to be able to balance pelvis and everything like that. But I get asked about them a lot, especially with breech baby, because that's really what they're known for too. So along with adjusting my mommies, a lot of times I say throw it all at that baby. We won't need that, especially especially 37, 38, and 39 weeks. We need everything and anything to help that baby to turn naturally, especially if you're hoping for a vaginal delivery. So they are great exercises, and you can really do them anytime during pregnancy.
Yeah, that's awesome.
Yeah. So let's talk about wishes, who else you might want to have a part of your team, and a little bit about, I don't want to say rights necessarily, that sounds very strict, but some things that you can do if you're not happy with your provider and stuff like that too. So like I said, I like to call birth plans birth wishes, because like Dr. Christina said, you can go in with the best laid plan and it may not go that way. Happened in my case. You can look on my risechiro.com website. I think it might still even be on Facebook. I share my birth story in a 2-part because it needed 2 parts. But I really think the best thing you can do as far as a plan or wishes is just to really know all of your options and what the heck that means, right?
Right.
What is an epidural? What is Pitocin? You know, and why is it good? Why is it not good? And I think just being empowered is really the thing that mommies need to have, you know? When you go into delivery, if things start to go not as you had hoped or planned, you knowing that you have tried everything in your power to have baby vaginally and naturally with no drugs, you know, it's much easier on the, I'd say, postpartum psyche and brain to know that you definitely had the control, right? Instead of the doctor saying, all right, we're gonna need to do Pitocin now, and you're like, but why? Like I'm fine, you know, and just because that's what will happen in delivery. Yeah. Very, very, very few times in a hospital setting will you get we're gonna do Pitocin because of this and this and this. You know, very much so it is we're doing it and you're not asked at all. So I think it can be very empowering to have the ability to say, or your doula, which we're going to talk about, or partner to know, no, we don't want to do that. There's no medical necessity to do it.
Yeah. So I think having all that information is hugely important. And also, if you don't want to have an all natural birth, like, don't like that's great.
Yeah.
You know, do what you want.
Yes.
Like do what you go into that feeling very confident. Just do what Dr. Ashley's saying basically is get all the information that you can so that you know the risks of all of it, right?
Yeah. Yes.
And I think it would also be great to be able to ask your provider, you know, barring any sort of emergent situation, like how do you normally handle if you think that I need Pitocin? Like what are the indications for that? When would I expect that to happen? If a provider comes in and is just telling you about your birth and telling you what's going to happen, it's totally fine to be like, hey, can you explain that to me a little bit more clearly? These are the questions that I have. Can I have a little bit of time to think about it? This is what I'm looking for.
Yes. Yes.
This is what was important to me. Hopefully, like you have time, like before things get really crazy. Like a lot of the time, having a baby can be a lot of waiting. So that waiting is a lot of time to like have these discussions with your providers.
Most of them should really be happening before you're even in delivery. Yeah. But I realize sometimes that doesn't happen. And sometimes if you're just not all that educated, like not like educated in the sense of like what can happen during birth, all the options is what I'm talking about. But that's why it's super important, which is whatever number we're on our list, is we highly recommend having a birth doula. Yeah. You know, sure. I have so many mommies that come in and it's like, yeah, my husband's going to do that. And well, I love my husband to death. In delivery, it was a marathon for him too. He was tired. He was exhausted. When things started to not go the way that we were hoping it to go, it was much easier for my doula to step in, being a third party, than my husband, who's just looking at like his wife in pain. Sure. Baby was fine, so that wasn't a big deal, but mainly his wife in pain, and it's been a really long time. Yeah. So I think it is so important to have a doula. I know more hospitals are offering it for like really reduced prices or free. I know a lot of the doulas around here have sliding scales. So I say to at least reach out to a doula.
And just know that not all doulas are made equally and not all doula packages are made equally. So while something looks really expensive, it could look expensive on the front end, it may get you way more services in the long run. So just ask a lot of questions. You have to just talk to some people and find people. You also want people who are going to be a good fit. Some people I've also seen are like, oh, my sister's had 8 kids, and so she's going to be my doula, which is fine if that's the relationship you have with your sister. But just know that your sister is going to be invested on another level and bring her own stuff to your delivery that a doula that is not related to you will not have.
Right.
So I think that there's some value in that.
It's very different. It's very different from a trained doula to a family member supporting you. Now, if your family member is a trained doula, that's awesome, you know, but a doula is trained in birth and all of the interventions and what that means. And they sit down with you multiple times before you even have baby to discuss that with you.
Yeah.
What do you hope? They'll check in with you postpartumly. A lot of times your family member supporting you is like, let me give you a little massage, squeeze the crap out of my hand and go. You know, it's just they don't have that education behind them either, you know. So
and I think it's extra important for people who are part of the LGBTQIA community, like, or if you're bringing something else to your birth that or you're worried about not getting good care, definitely get a doula, because that's just going to be one more protective measure and one more person who's on your team and can help communicate with doctors and give them the information that they need. In a way that takes the pressure off of you. Right.
Yes. No, totally. And like Dr. Christina said, interview.
Yeah.
We have most areas are blessed to have many doulas. So, and there's nothing wrong, and they welcome you interviewing them, right?
Sure.
Just as they may feel like you're not their ideal client, it may be vice versa. And going through the birthing process is very, can be challenging, super intimate. You know, you want to have somebody on your side that you fully trust and you like. Right. So it is okay if you don't hire your first one. You can interview a few of them and they won't be upset about that.
Yeah.
Well, and if they are, then that might be kind
wasn't a good fit anyway.
Exactly.
Which brings us to our next and last point, which is that if your provider isn't serving you, you can fire them. Yeah, it's totally fine. You are the consumer. Like the way that the world works here in America is that healthcare is something that you are consuming, and so it is your choice that if you don't like your doctor, you can cut them.
Right.
And that's totally fine. And they might have feelings about that. They shouldn't have feelings about that.
Yeah.
That's okay, and it's encouraged. We talk about this a lot, but I think we've probably been on both sides of it, where you have a provider who you don't feel is hearing you, who you don't feel is a good fit, you don't feel like they're incorporating you into your healthcare decisions, and that can really just ruin a healthcare experience. And especially with something as big as bringing your baby into the world, you just want to work with someone who you think has your best interest in heart, especially if something goes wrong.
Yes. Well, and you know, I understand and recognize the need for using insurance, you know, but sometimes those insurances are super restrictive and allow you like 2 choices of an OB, you know, and which is unfortunate and sad. And I do know that some will scare you into, and there are some that will not accept you late in pregnancy. Option in a home birth midwife, especially if you're feeling some kind of way about just that whole hospital situations. But I know almost all of the home birth midwives will take you at 40 weeks if they got to, you know, like they don't have that like, oh, I haven't seen you all prenatally, you know, so we're not going to see you. And that is always a great option. Some insurance plans will help you with a home birth midwife, some will not. Again, I know almost all of the midwives in the Denver area have some sort of program or sliding scale to help you out or to allow you to make payments. You know, I know most of them will work with you. So just know that if you're not feeling supported, you're not feeling heard, that you can always look for another OB. I would say even better, go with a home birth midwife. I know home birth in itself is, you know, some people have feelings about that, right? And that is totally up to you. But if you're going into labor and you show up at labor and delivery, they can't turn you away.
Yeah,
so
no, they can't.
You know, exactly. If you're feeling like maybe I just need to like mosey on in at 10 centimeters dilated, like, hey, that works too. But just like us, right? Like, you know, I always tell my patients, like, if for whatever reason, if I'm just not the chiropractor for you, I want you to get chiropractic care. Right. So, dude, it's not going to hurt my feelings. Just ask for a referral, you know? Like, I have a wealth of people, and that should be the same way. in that community, just sometimes it's not.
Yeah.
You know, but you can definitely change whenever you want, for sure.
And for me, I would much rather you go see someone new than just like wash my hands of you and hope that insurance, whoever you found on your insurance website, worked out.
Right? They might know. I would hope they at least know what the pelvic floor is, but
Yeah.
something beyond that, right? Especially in that world. Yeah, but I think, I don't know if that was 10. We'll call it 10.
I think it was.
10 with
10-ish.
a few more added in there, of course, and a little bit longer video today. But we're just extremely passionate about our mommies and making sure that they feel empowered. I do hold classes, kind of revamping them a little bit on the prenatal side, but just really empowering mommy, going over all the interventions and stuff like that. Obviously, if you are a current patient of mine, or even if you're not, but you just want some help, please reach out. I always am open to talking about what your options are and everything like that. But definitely, if you're here, come see us.
Yeah. If you're pregnant and you want like a preparing for birth sort of appointment, we can totally do that.
Yeah, for sure. Like I said, go get your pelvic floor checked out, and I'll check you for alignment. I like to do that too. All right, you guys will have a great Tuesday. Team. Thanks for hanging in with us, or hanging on with us. We'll see you next week.
On, around, and through.
Whatever.
Bye.
Yeah. What? Do I still have to be quiet?
It's always this one.
Or
I don't know why. I can't help it.
Say hi. They would appreciate you saying hi. Oh my God, it's so hot.
I have a weapon.
Let her do her thing. Oh my goodness.
I'm just forced to the bush.
I don't know what it is.
Still? Just hush.
I just have an hour.
That's fine. It's always like 6 minutes of me.
Something does it plug it with the phone?
It might be. I wonder if it just like overheats and stops.